Imagine finding out that you're pregnant. It's a shock to you, but you're elated and you can't wait to share the news with your family and friends. Your due date is August 31st. The whirlwind begins, finding a competent obstetrician, choosing a baby's name, picking out nursery decor and colors, interviewing pediatricians and deciding on a birth plan. The list goes on and on. One evening, you come home from work, tired and exhausted, and you plop down on the couch. You don't feel well, but you chalk it up to the demands of life and work. Hours pass and you just can't shake the feeling, so you give your doctor a call. He tells you to get to the hospital just to make sure everything's okay. What happens next feels almost impossible to comprehend. You're 28 weeks pregnant, the baby's in a breech position. You're almost fully dilated and you have to have a C-section right now. Doctors and nurses fill your room, trying to explain what's happening to you, what will happen to your baby, and prepping you for surgery. You're on information overload, and nothing makes sense. You're in complete denial, and you shout, "How can this be happening to me?" Did you know that 1 in 10 babies born in the United States is born prematurely? I'm going to share with you 3 tips on how you can survive the NICU life. That's the neonatal intensive care unit. Number 1 is have a health advocate. Number 2 is the importance of self-care. And number 3 is ask lots of questions. Did you know that one study showed that 43% of NICU parents may have a low level of health literacy, which impacts their ability to understand, retain, and process information? The responsibility of a healthcare advocate is to help you understand what's happening to you, your baby, and discuss your care options with you in language that you can understand. If you need a healthcare advocate upon admission, one can be appointed to you at the hospital upon your request. A health advocate can be a spouse, a relative, a friend, or a caretaker that you trust. It's recommended to provide your healthcare advocate's contact information to your healthcare team to provide a continuum of care. Having a healthcare advocate can be a life changer when it comes to being hospitalized, but even more so when you're thrust into a dire medical situation that you have little control over. Your advocate can take notes for you and help you make important decisions. When you've recovered from your surgery and you're finally able to see your baby in the NICU, it might be shocking. The sight of your baby in an incubator, hooked to monitors, IVs, feeding tubes, and the sounds of monitors beeping can be so overwhelming. This is a completely normal feeling. It's just not comfortable. Your advocate can be there to reassure you and explain things in detail, since you'll likely be medicated. It's okay to ask for information in writing, so you can refer back to them when your mind is more clear. Designating a healthcare advocate is important so that you can be empowered and informed every step of the way. Did you know that approximately 70% of hospital patients utilize a healthcare advocate during their stay? That's a whopping 30% that go through this alone. Self-care is often neglected, but extremely necessary to your survival. Get some fresh air if you're able. Even if you've had surgery and you're not completely mobile, have someone wheel you outside for some fresh air. It can help you clear your mind and provide you the energy you need to push forward. Rest, rest, and more rest. You'll need all the energy you can to best take care of your baby. Many new NICU parents set up shop at their baby's bedside and never leave. While this is admirable, it won't help you in the long run. Try to get several hours of uninterrupted sleep each night. The NICU will have all of your contact information, and they'll call you if there's any problems. Talk to other parents, whether it be in person at the hospital or through a small group. Talk to other parents with babies in the NICU. You can learn from each other and lean on each other. There are many online resources and groups on social media. One is the March of Dimes, and another is Graham's Foundation, which I'll talk more about at the end. NICU journeys, whether short-lived or long-winded, will feel like being on a roller coaster. The emotions you'll experience will vary from one end of the spectrum to the other, often in the same day. You'll learn to take things minute by minute and live in the present. Taking care of yourself by getting fresh air, resting, and networking with other parents will help you along in your journey. The third tip is ask lots of questions. When visiting your baby in the NICU, you'll likely want to know what they're doing and why. Ask questions, and lots of them. Sometimes doctors and nurses use terms that you may not understand. Ask for clarification, and ask for everything in writing. Some important questions to ask are, how often can I visit my baby? When is the nurse shift change? And can I take part in cares, which includes weighing and changing diapers? When does the neonatologist do their rounds? And can I speak to the doctor and ask questions about my baby's care? If you're breastfeeding, you can ask where to pump and what to do with the milk once you've pumped. Asking questions, being part of your baby's care plan, and understanding your rights are important as you process information. If you don't remember, just ask again. In conclusion, all NICU journeys are stressful and overwhelming, but you can make it easier to deal with by following the guidelines I mentioned. By designating a healthcare advocate, prioritizing your own self-care, and asking tons of questions, you can better be prepared to survive the NICU life. For additional information on the March of Dimes and the Graham Foundation, you can visit them online at www.marchofdimes.org and www.grahamsfoundation.org. Thank you.